Sonoma County, the chosen spot of all the earth as far as nature is concerned, according to the famed plant wizard Luther Burbank. A diverse county with 1,010,000 acres of land and 1,574 miles of scenic roadways. Sonoma County is rightfully famed for its agriculture, viticulture, industry, and recreation, as well as for the amazingly successful ethnic and economic mixture of its more than 340,000 residents, and for the forward-looking philosophy of its local governing bodies. Now, we invite you to take a closer look at Sonoma County in the 80s with your host, Rich McGlinchey.
Welcome to a special edition of Sonoma County in the 80s. You know, we have had a lot of emergencies in Sonoma County. We've had floods, we've had earthquakes, we've had hazardous spills. There are probably many, many more that I can't think of right at the moment. But emergency services have been very, very important. Not only emergency services as under the direction of Pete Paterka, when we've got someone trying to move people out of a flood area or something like that, but perhaps the most important area that the county has anything to do with when an emergency occurs is emergency medical services. We know that when there is an emergency, people are hurt. We know that things happen. We know that the county cannot use its normal facilities. We know that it has to find some way to get medical supplies quickly. It has to have, I guess, paramedics. The woman who is my guest tonight is going to tell us all about that, and she is very experienced. Her name is Phyllis Haggerty-Murdock, and she's the, well, actually, she's the coordinator for emergency medical services, or as we say, the EMS coordinator. Did I get it correct?
You got it correct.
Hi, Phyllis.
Hi, Rich. Nice
Phyllis
to see
has been
you.
with us a time or two before, and we talked about the subject of emergency medical services, but I don't think we covered it nearly as well as we might, and I'd like to get right into the questioning right now, and I hope that you pay very close attention tonight, ladies and gentlemen, because what she's going to tell us is really, very important. It's very important to yours and my survival sometime in the future. Phyllis, that leads us up to number one. What is emergency medical services?
Well, it's two different things. Emergency Medical Services is the name of our agency. Mm-hmm. There are several agencies like mine throughout the state of California and around the nation, but it's also the name of the care given to people in Sonoma County by fire department, first response personnel, by the ambulance personnel who may transport you to a hospital, and by the people in the emergency departments of hospitals that you eventually go to when you have a medical emergency. Mm-hmm. And all of that is known as the Emergency Medical Services System, and that system is what my agency manages and coordinates in Sonoma County.
Let's back up just a little bit. You are a part of or connected with the Public Health Service, is that correct?
That's correct. The EMS agency is a division of the Public Health Department in Sonoma County. And throughout the state of California, there are various agencies like mine. Some of them are in public health departments, and some of them are private agencies that have formed regions to fulfill the planning function of emergency medical services for their counties.
Mm-hmm. And our public health services are under Dr. Bob Holzer. And
right. Dr. Holzer is the medical director for the EMS agency.
Okay, all right.
As well as being the county health officer.
Right, he has many hats up there.
Yes, he does.
Oh, he sure does. Phyllis, is your agency a part of a hospital emergency room?
No, it's not. We work with all of the hospital emergency rooms, but we are not affiliated with any one hospital emergency department. And that's a question I'm frequently asked by people who think that the functions that our agency performs are those that belong to just a single hospital. And in fact, we work with all the hospitals in the county.
Well, I think the word emergency sort of tends to lead you into that thought that it might be the emergency room. All right. You've kind of explained the agencies in essence, but what does the Emergency Medical Services Agency actually do?
The state of California writes regulations regarding emergency medical services, and our agency is responsible for implementing those regulations, and those regulations govern how paramedics are trained, what level of care they do give to people in counties. We have quality assurance that we have to do for all of the paramedic programs in the county. We do disaster planning for the medical aspect of a situation that could be an emergency in the county. We also coordinate the dispatch of ambulances, and we help provide training, and we're a resource agency for people who are interested in providing care. We do certification process for EMT1s, EMT2s, paramedics, and mobile intensive care nurses in Sonoma County. We do other things, but that's a general picture of what we do.
Okay, emergency medical services now. We've kind of got a description of what we're talking about. How is it funded?
It varies throughout the state of California. In our case, we receive our money from the County General Fund, and we are currently the recipients of a grant for disaster planning from the state of California through the EMS Authority. And other areas in the state of California receive money from the counties that they're in, as well as private providers. Sometimes the EMS agencies receive state funding in addition. And we haven't done that yet. We are a single county, and we in the future may pursue forming regional efforts so that we might be the recipient of some state money, but currently we haven't done that.
You know, emergency medical services, to those of you in the audience who are finding this your first contact with this particular agency, you'll find that, as I said earlier, that's extremely important. Just a few months ago, we held an exercise out at the Sonoma County Fairgrounds, which was widely attended by not only the media, but many of the public, and certainly the agencies from all over the state. And it was certainly an eye-opening experience. Back to our questions here. How does the emergency medical services serve the taxpayer?
When you need emergency medical care, you need to have the best emergency medical care available. And our job, and one that we take a lot of pride in and we take very seriously, is making sure that the kind of care you receive is the most up-to-date emergency medical care that you can receive. So we try very hard to be progressive in our EMS in this county. We try to make sure that the regulations that are adopted are practical for Sonoma County, that the paramedics have adequate quality control, that we have equipment that's up to date, and attempt to work with all of the ambulance providers and the hospitals and the fire departments to make sure that what we're doing in emergency medical services is state of the art. And that's the way that we feel we serve the taxpayer best, to make sure that you get the most you can for the money that you pay for the service.
Well, am I safe in saying, from a layman's standpoint, that emergency medical services is doing everything possible to provide emergency medical services, if just what it says, in the event of an emergency for the entire county at the highest quality possible?
Yes, that's right. That's right.
That kind of covers it in general.
It does.
Okay. You mentioned the ambulances, and you can control that now. There's a very interesting question. Does your agency set ambulance rates?
No, we don't. No, we don't. That's another question.
You're happy to say, no, we don't.
Well, it's a very complicated issue,
It
and
is.
there are many, many facets to the rates that are charged by ambulance companies, but the county does not set ambulance rates. Those are private providers or public providers in some instances, and those rates are set individually and not regulated by the county.
Okay. There's one thing I'd like to say about this. There has been a lot of discussion. There's some controversy over ambulance rates, costs, and this sort of thing. But I think it's something that ought to be said on behalf of the providers, too. I know I've been in a couple of life-threatening situations in the last decade, and had it not been for prompt ambulance service, I might not be here with you tonight. I think that in looking at some things, I think there's probably a way to improve almost anything. And there's certainly the opportunity to lower cost periodically. But I think before, if anyone were thinking in terms tonight of I had an ambulance bill that I thought was very high or something like that, that may be true, but you must realize that it's a life-saving circumstance a lot of times. And I'm not, in the business to advertise the ambulance companies, but I really think that fairness ought to be on both sides. Is the cost for ambulance services subsidized by the county?
In some aspects it is. In the low call volume areas, there is a small subsidy given to ambulance providers in the county. That's because there is a break-even point at which an ambulance must have a certain amount of calls and derive a certain amount of income in order to survive. Sonoma County does give a small subsidy to the more rural ambulance companies. The major metropolitan areas in Santa Rosa, Petaluma don't receive a subsidy. The lower call volume in the very rural areas do. And there's also a small payment available for indigent patients that the ambulances have that they can't collect payment on. The county has a cap on that amount of money, but they do, if a certain type of paperwork is submitted with documentation, there is some money available to pay for those no-pay patients, as they're called.
Do you find your job fascinating?
I love my job.
Yeah.
I love my job.
You know, you may or may not know, and probably don't know, that Phyllis Haggerty-Murdock was also a firewoman, or fireman, if they want to call it that. And I promised that I would ask her, are you still chasing fire engines?
Boy, I love it, and I wish I could do it more, but yes, I still have a fascination with fire engines.
She did.
The people that I work with know that.
Well, you were considered outstanding at the job. You really were, by the people that worked with you. I know, because I talked to them. All right, what happens when I call 911 for a medical emergency?
If you live in the county, that is not in the city limits of any area in the county, you will get the county's dispatch center. And the county dispatch center has 3 consoles set up for law enforcement, fire, and medical. Depending on what your emergency is, they will dispatch the appropriate vehicle to your house. And if you live within the city limits, your call first goes to what is called a PSAP, or a public service answering point. And that call is handled by those people and transferred, if you need an ambulance, to the county dispatch center, where it's a button pushed, and that's as fast as it happens, and then an ambulance is sent that way. So throughout the county, you call 911 and you'll get emergency response.
That one little thing on that, the call shows the location where the call came from, too, doesn't
Yes,
it?
it flashes up on a screen.
Oh, yeah, tells them about that. Okay, we're going to pause for just a moment.
Okay.
Ladies and gentlemen, Phyllis Haggerty-Murdock, and who is the Emergency Medical Services Coordinator for the Public Health Department for the County of Sonoma, and I will return and we'll talk more about emergency medical services because it's an extremely important subject. First, these important messages.
When you lend a helping hand, you give yourself away, becoming something so much more than words could ever say. A brother to your neighbor, and to those in need a friend. Won't you give today the united way, bring happiness again. True love is still the answer, we are still the way. The gift is in the giving and in living what we say.
This is John Denver asking you to make your United Way pledge now and give for a better tomorrow for all of us. And thanks, because thanks to you it works for all of us, the United Way.
Welcome back, ladies and gentlemen, to this edition of Sonoma County in the 80s. On this particular program, we're talking about emergency medical services, and we're talking to the key person in that particular situation in the County of Sonoma, Phyllis Haggerty-Murdock, and she is the Emergency Services Coordinator for the Public Health Department for the County of Sonoma. And that sounds like a long title. It is, but then it befits the person because she does a lot of things. Now, a minute ago when we left, we asked you what happens when I call a 911 for a medical emergency. But the question I wanted to ask right after that is, when should I or anyone else call 911?
You should call 911.
Maybe I should say, when shouldn't I?
You shouldn't call 911 if you don't have a true emergency.
All right.
So if you open a can of cat food and you cut your finger on the lid, don't call 911.
Okay.
But if you walk out your front porch,
You're an hemophiliac.
well, yeah, it would have to be a big cut. I mean, it would have to be major problem there. But what I'm trying to emphasize is that you don't use the 911 number for a minor emergency. If you have a situation that someone is seriously injured, you have a fire, you have a law enforcement emergency, you need to call 911, but please don't abuse that number if you have a minor situation that you can take care of at home, your neighbor can help you take care of. We don't want to say not to use 911 if you have an emergency, but the dispatchers on the telephone will be able to help you determine what kind of an emergency you have, especially if it's a medical emergency. We use a dispatch triage, and triage is French for sorting. So we sort out the calls based on what you tell us your problem is, and the dispatcher will send the appropriate level of care to you as long as you stay on the line. It's very important when you call 911 to stay on the line and talk to the dispatcher so they can find out exactly what's going on, even after they've sent an emergency vehicle to your home.
Yeah, and incidentally, perhaps I'm being trite, and I certainly do not mean to insult your intelligence, but when we talk about 911, you dial 9 and you dial 1 and 1 again. Many people, believe it or not, have assumed that that was 911, and it's even been stated by newscasters at 911. And this is incorrect because some people in an emergency have looked for an 11 on the dial, and there isn't one, as you well know. So if you're thinking of this emergency number, and I'm not really being facetious, dial 911. Don't do it unless you need it, unless it's a true emergency, as Phyllis said. But if that is the case, 911. All right, what's the difference between the county's Emergency Medical Services Agency and the County Office of Emergency Services? And I found out because I made a mistake last month or two, but you tell the public.
I'll be happy to. The Office of Emergency Services is the agency that's charged with overall emergency preparedness in the county and disaster management if we have a disaster. Emergency Medical Services deals with what I talked about earlier, which is a planning mechanism that deals with pre-hospital response. It deals with planning an emergency medical system. And the Office of Emergency Services and my office work closely together, especially in the disaster field, because we are responsible for disaster management in the medical arena. They are responsible for the overall management of a disaster scene. So we take care of, in disaster situations, managing those medical resources within the framework of disaster management done by their office. Now, Office of Emergency Services does many other things besides just disaster management. They do a lot of face-to-face counseling with people about how to prepare for emergencies. And they talk about hazard mitigation, I think is Pete's favorite term. And that is just ways you can get ready for any kind of an emergency to prepare yourself. We do that also, only we focus strictly on the medical end of that. We are interested in having people be prepared for dealing with medical emergencies in the framework of an overall disaster. So we want people to make sure that they can take care of themselves and their families medically in a disaster.
And we might throw a plug in there. Pete Paterk and his agency do a splendid job in their aspect of it, and Phyllis Haggerty-Murdock and her EMS group do an equally fine job on their end of it. So we're very fortunate in this county, I think, to have both an effective emergency services organization and an equally effective emergency medical services group.
That works together.
I think maybe the audience would be interested in knowing this. This kind of causes you to paint a little scenario, I guess. What does the Emergency Medical Services Agency actually do during a disaster?
We have developed something called medical support zones in Sonoma County.
First of all, you hear about this through the emergency channels, I presume. Okay.
Right.
Okay, now go ahead. Now, excuse me, I just wanted to...
That's okay. We work at the EOC, the Emergency Operations Center, down in the county center, and I would go and my staff would go to that center. We would make sure that the medical support zones that we have developed, and those support zones are based around the 6 hospitals in the county that have emergency departments, who have set up an independent means to take care of a certain section of the county geographically. Those zones have a staff person that is assigned to coordinating the resources in a given part of the county. So they would be functioning independently. I would be at the Emergency Operations Center to talk to them over the radio if I needed them and if they needed me. We have a agreement worked out with the RACES, which is the radio amateur group in the county, and they in many cases are putting radios in the medical support zone first aid station areas so that those places can be staffed. We also would be coordinating hospital capability from the EOC to find, the hospitals would be talking to me over the radio, telling me whether they were full, telling me whether they needed things. I would be working with central dispatch to see if we needed ambulances from other counties to come and provide mutual aid for us. All of those things would be something that my agency would be coordinating from the Emergency Operations Center during a disaster.
Mm-hmm. All right. I've been reading about, I think it's called a trauma center being planned for Sonoma County. What is a trauma center?
Well, actually, we're planning a trauma system, and a trauma center fits into a trauma system. Mm-hmm. But a trauma system is a coordinated means with all of the hospitals and the ambulances and the fire services to provide the best care, the fastest care, to a patient who is the victim of a major trauma. Mm-hmm. The goal is to get that patient as quickly as possible from the time they've been injured to a facility that can stabilize them and provide specialized care for their injuries. And in other parts of the state and in other parts of the country, that has been a trauma center. Mm-hmm. In Sonoma County, we have a lot of rural area, and so our system is going to be configured based on the fact that we have excellent hospital facilities in this county, and we are also going to have a trauma center, I'm sure, but the outlying hospitals will be involved in the trauma system as well as the trauma center.
System is what I meant to ask about, because I know the center is involved in that, and the system is what you described. That's what I wanted you to do. Phyllis, under what circumstances would members of the public actually contact your agency?
Anytime they have a concern about emergency medical services that are provided to them, anytime they have a question about what kinds of emergency medical services they need or whether they feel that they want more, or any questions they have about care that's given to them, policies that they may read about in the newspaper, those are the kinds of issues that they can call about. Or if they want to get involved in the public review of documents that we're working on.
Where is your agency located, and how would someone reach it by phone?
We are at 3313 Shenate, and that's right across from Community Hospital in the Public Health Building. And they can call, and our phone number is 527-2758. And my staff is available. I'm available to answer any questions. We have lots of committees people can get involved in, and I always need volunteers. Always need volunteers.
527-2758?
That's right.
That's the number, 527-2758. And you say there are available places for persons to serve on your committees.
We have a lot of things going on.
Then they should perhaps contact you, and that's 3313?
3313 Shenate.
3313 Shenate Road. Is that 401? 95401?
404.
404. Okay, 3313 Shenate Road, 95404, and it would be the Emergency Medical Services. It's part of Public Health Department. So if you're interested in serving on one of the committees, now would be the time, or in the very near future would be the time to pick up the phone and call Phyllis or a member of her staff, as she said, and let them know, because they do need input and they do need people to work on these committees. Okay. This is partly what we're talking about here, but I want you to elaborate on this question. We have about 2 or 3 minutes left. What can the public do other than volunteering for the committees to become involved in the EMS system? Is there any other way that they can help you?
They can be sure that they are prepared for dealing with medical emergencies in their own families. They really can. It's important that every family keep basic first aid supplies in their home. Yeah. It's important that you teach your children the basics of taking care of minor injuries. And it's important that you teach children and older people when to recognize that they have something serious happening that requires the services of an ambulance or a fire department to respond to your home. Those are things that people can do, and I can't emphasize enough that we live in earthquake country and that people need to be prepared for a disaster in their homes.
There's a couple of other things I want to ask you, Phyllis. One of them is, around the county, Now, this is a thing of the past, and I want to know if it's still a thing of the past or whether it still exists today. At one time around the county, they had stashed, if you will, sort of portable emergency hospitals. Is that sort of thing still true today?
We still have those. And those are medical supplies that are in semi-trailers, and they're available in a disaster to be moved around the county to provide medical supplies to areas that we might have roads that are unpassable, so that we can make sure that people do have those supplies. So
We were at your fire station office at one time there.
yes, we did.
At your happiest. I always kid her about this. But really, you did show us a particular packet of a thing like that, and that was one of those emergency type things that can be used.
That was a different type. Those are first aid stations, and there are 72 of those placed around the county.
Good.
There are some of them in fire stations now. They don't have to be moved. They're just set there for whenever we need them. They were used during the flood in Guerneville. And we have 72. We are funding those one more time this year, and we hope to be up to our limit, but those are something that have been placed there by your support zone committees, and those needs have been addressed through the planning that I've talked about earlier, committees that I'd like for anybody who's interested to get involved in.
Okay,
Very important.
we're out of time.
Right.
It always goes fast, doesn't it?
What if I would have given 20 questions? We'd be in big trouble. I knew that those questions were going to take longer, so I said, if I gave Rich 20 questions, we'd be...
Yeah, I said we got to have some kind of order to this. Okay, we have been talking to Phyllis Haggerty-Murdock, and she is the Emergency Services Coordinator for the Public Health Department of the County of Sonoma. We've been talking about emergency medical services, and as I've said earlier in the evening, this is probably one of the most important subjects that the public in this county can learn about, because we do have emergencies. We've had earthquakes, we've had floods, we've even had a tidal wave once. We've had hazardous spills. And I think it's very, very important that you hear from, if you don't mind her, calling her the expert in emergency medical services, Phyllis Haggerty-Murdock. My name is Rich McGlinchey. The public is Sonoma County. The program, rather, you're the public. The program is Sonoma County in the 80s. I hope you'll join us next week. We'll talk to another member of the county government family or a related agency that is very important to you and I. Until then, good night, good luck, and good health to you all.